Just imagine you are explaining your patient about their condition, interventions and everything, and suddenly your patient tells that they feel their heart is racing, and when you test it you find out that that is around 220 beats per minute, which was before around 75 beats per minute. So what will you do in this situation? That is what we are going to discuss in today's question in Physio Quest series. So before going to the answer, options and everything, let's understand the situation given here first. So whatever is information is given, in that clearly we can make out that there is no history of any cardiac condition for the patient. Patient is not having any serious cardiac condition right now also. There is no mentioning in the question anywhere. So that is why we can clearly say that this might be case of PAT, which we also call it as paroxysmal atrial tachycardia. Now in this situation, what should we do first? That is what is asked in the question. So let's go through the options one by one. The option 1 is telling that you have to start with the emergency response. Option B is telling that you give Valsalva maneuver to the patient. Option C is telling ask patient to do deep breathing exercises. And option D, which is telling you that you should refer the patient to the primary healthcare physician of the patient for the cardiac reference. Now out of these 4 options, I feel that the second option, which is asking patient to perform Valsalva maneuver, is the correct one. Why? Because just now as I told you, this is a case of paroxysmal atrial tachycardia, which means what? That suddenly there will be rise in heart rate because of any emotional outputs or input for the patient or the situation, depending on situation. Some patients have that because they are listening to something or because they just come across some situation, their heart rate suddenly rises. So in such situations, if you think of that, let's give patient directly some emergency response team and emergency services to the patient, that doesn't make sense. You have to first try that you are giving certain treatment, you are trying to make patient calm down, and if the heart rate comes down, then yes, definitely after that this next step what we can do is we can suggest patient to go for the primary physician's reference for their cardiac health checkup. But the immediate response should not be like we send them for the emergency care service. So emergency care services definitely is not the correct answer over here. So if you have chosen that option, you need to think about the situation that in question, nowhere it was mentioned about that patient is having any history of cardiac condition or patient is having any cardiac condition right now. So as a physiotherapist, it is our responsibility that we try from our side to calm down patient, to reduce the heart rate. If still it is not reducing, then the second thing what we do is asking patient to go for the reference of a cardiac surgeon or cardiac physician. So the answer over here definitely is option B. Why? Valsalva maneuver is correct option now. So to understand that, you need to understand that Valsalva maneuver, what we ask patient to do is we either ask patient to cough, like when you ask patient to cough what is happening? You are actually activating the parasympathetic system. So parasympathetic system, when it is activated, it automatically calms down your heart. That is what the action is. Otherwise, if the option was given that we will give beta blockers, which also works for reducing or activating the parasympathetic system. So beta blockers is not given, but yes, Valsalva maneuver does the same thing, which is activating your parasympathetic system. That is why that option remains the correct one. Now you will say that why can't we ask patient to hold the deep breath? Because that is going to create hyperventilation. Hyperventilation means what? That you are going to exaggerate the condition. You ask patient to do deep breathing activities, what will happen? Your heart rate will keep on increasing. You will not be able to stabilize it. I know that most of you have written this answer, most of you have polled for this answer, that we will ask patient to do deep breathing activities. But you just imagine by yourself that when you are doing deep breathing activities, what will happen? That your heart rate will still increase more, or it will just sustain over there. So we don't want that for patient. That is why that option cannot be correct. And option D, which is suggesting referring patient for the general physician for cardiac health checkup, that we should do. But before that, first we will calm down the patient and after that we will refer. And in the question, what was asked? The question, it was asked that what is the first thing as a physiotherapist you will do? So that is why that is not the first thing. That is why option D also not correct answer. Option B was the correct answer over here. I am sure that you have understood the question as well as the reasoning behind the answer. If you still have any doubts and if you want to learn more about the different conditions and case scenarios, then you must follow Physio Trendz and subscribe Physio Trendz channel and watch the Physio Quest series.